want you to be able to identify what the Nclex question is really asking you. What is the truly relevant information pertaining to the question? What are the key words or phrases to help you answer correctly, and strategies to help you weed out the wrong answers? We want you to utilize the test-taking strategies provided while you practice answering the Nclex questions. So we want to give you hands-on opportunity to do that from the very beginning of the course. So let's look at about the Nclex. The Nclex exam is really testing your critical thinking skills as a nurse, not just your book knowledge. This is really important to remember. You must be able to think like a nurse on your feet, providing the patients with great care, making the right decision at the critical moment when it's presented to you. Focus on what you do know on the exam, not what you don't know. You're going to have book knowledge and things that are rote memory that you can remember, but you really need to be able to focus on what you do know, certain drugs or certain medications. Just think back and relax. Review all the information that's provided to you on the question. So there may be some relevant information or irrelevant information. Just walk yourself through and review all of the information provided. The bottom line is that determining the priority issue is the most critical, and that's a good majority of the questions on the Nclex. Many times a nurse is presented with a patient who has a number of issues at the exact same time, and you must be able to prioritize which one is the most critical to address at that time, and what is the priority treatment to provide to that patient. So let's take a look at some test-taking tips. Reducing your anxiety for test taking. Most people are not good test takers. So we have a couple clues or suggestions that you might want to take a look at before you take the exam. Learn to meditate before the exam. Really get your heart rate down, really relax, and become one with taking the exam so that you're not totally freaked out. Imagine successfully answering the questions and passing the exam. What you think about is what you create. So if you feel like you're going to fail, you probably are. We want you to think positively. We want you to get enough sleep. Don't cram the night before. Make sure that you're relaxed and you're prepared. Eat before the exam. If you're hungry, your brain can't focus, and you really need to be able to focus and concentrate to take this exam. Know that you must answer all of the questions and that you can't skip a question and go back. So unless you have to do process of elimination or just do a guess, you've got to do that in order to go forward. The bottom line is really to breathe, breathe, and breathe. If you're not breathing, you're not getting oxygen to your brain. And as most people, we get tense and we tighten up our muscles, and it's not really helping us to relax our diaphragm and breathe. We really want you to be able to practice the exam questions and give yourself 1 to 2 minutes per question. So use your watch or use your phone and test to figure out what 1 to 2 minute feels like. You'd be surprised how long that is, and we always feel so rushed when we're taking exams. And the last tip that we can give you is to really train your brain. Sit down and answer 75 questions at a time. Answering 1 or 2 questions on your lunch break or on your way to work is not going to test your brain and strengthen your brain as a muscle. It really needs to learn how to practice to concentrate, especially if you've been out of school for a while. So that's really key. Test-taking strategies. The number 1 is Maslow's hierarchy of needs. Your physical needs of a patient are going to take priority over your psychological needs. So the patient's airway, their breathing, their circulation, that's going to take more precedence over if a patient is depressed. So keep that in mind when you're answering questions. I cannot stress enough to read the question slowly. Then read your answer choices slowly. We tend to skim over the answer and then we end up getting stressed out because we're missing key words. The next section would be to really figure out what the stem of the question is. What is this question really, really asking me? Look for key words and key phrases. Key words such as most, least, never, always, every. Those are key words to help you kind of identify what the correct answer would be. Look for key phrases. The patient needs more teaching. The patient understands teaching. Those are really going to help you to understand if it's a negative or a positive in the question that you're looking for. Nclex, in the bottom line, is testing your ability to prioritize. What is the first, the best, the primary, or the initial treatment that you as a nurse need to be providing? In addition, when they're asking you to prioritize, it's about delegation. What patient is the most priority that would need to go to an RN? What patient just needs to be ambulated that could go to a certified nursing assistant? what patient needs medication that a licensed practical nurse could provide care for. So the NCLEX is going to ask you to prioritize your delegation and prioritize what patient needs the most care when. Look for answer choices as the clue. Oftentimes the odd answer might be the right choice. An example of that is that all medications and the answer choices are NSAIDs, but one is a cardiac med. That's probably the choice. Look for opposite answers, words like increase, decrease, right, left. One of those is usually the answer. You need to know your positions. There's always a few questions about your correct position to place a patient during a particular procedure. In respect to the change of a condition, they have increased blood pressure, they have decreased blood pressure. What position would you place a patient in a semi-Fowler's position? You need to know that material. And keep in mind the nursing process in the questions. What is the question asking me? Is it asking me to assess, treat, or evaluate my patient? And that's going to be key in helping you to answer the question as well. Keep in mind your nursing process as to what the question is asking you.